Hi, I'm Marty and I'm the Player Welfare Officer here at the Pioneers. This is the first job I've done with player welfare directly at this sort of level, but before I was with Calville at the Calville Football Club, the Calville Football Netball Club for a little while, for a year. I've also worked at Malmesbury for 14 years at the Youth Justice Centre, and we had a football program up there, so I've done a fair bit of work. I'm a qualified mental health nurse, I've done drug and alcohol stuff and behavioural science and a whole range of stuff, so yeah, that's what I've done. What my role is really to make sure, number one, for the relocated players. You know, we've got players from Broken Hill, Mildura, Swan Hill, Echuca, all over the place, and they relocate here to Bendigo. It's pretty hard for 18-year-old kids. It's a really big year for 17, 18-year-old kids, in fact, where they're actually becoming adults. And so the whole idea is to provide them with the support they need, and when they need different things, to be able to direct them where they need to go. So if they needed some assistance with problems around mood issues or anxiety or stuff, it might be simply just referring them onto a psychologist so that they can get a little bit of support. If they need some medical stuff, refer them onto a GP. But generally it's about making sure that they're actually okay. There's been a few issues. We've had one young fellow that's not been travelling really well. He's had some dramas at home and had some mood issues, and what we did was give the parents some support. We also gave the player directly some support. We referred him off, gave the advice to the parents actually, because the kid wasn't actually relocated. So the advice was to the parents, this is what you can do. You go see a doctor, get on a mental health care plan. The mental health care plan will then be able to support the young fella in going to the psychologist. It won't cost you as much money, that sort of stuff, because that's what I've been doing for a long time. Other instances, like I've had kids, in particular, it's really interesting the way kids communicate these days. Facebook, so lots of support on Facebook, to and fro on messaging, and kids asking, what do I need to do to make myself a better player mentally and stuff like that. There's a fair bit of it actually. What we've done with the relocated guys is actually when they're here, is actually linking them with systems or services when they need the linkages. So some kids won't need anything, they'll be fine. But some kids struggle a little bit, just making sure that we keep in contact with them, make sure that if they've got any questions that we're always available to be able to see and talk and discuss what they need. What we are as Pioneers, I think what we've really done really well is that we've really tried hard to create a bit of a culture and getting people involved. The more people that are involved, then the more support mechanisms you've got and the more networks you've got. And it's really important to have that around, so that if you've got parents that are struggling because their young fella's struggling, you can refer them on, you can give them the support they need, you can give them information so that they can act on stuff. And I think having that network stuff, which will be built on further and further and further with the Pioneers as the way that we're going forward, will be really good for the club and for the players.